And while we may wait for more information on Hamlin's condition, health experts are weighing in, saying that these next 24 to 48 hours are crucial as to how that injury could have impacted the rest of his body. Our 18 News reporter Jacob Matthews has more on how to recognize cardiac arrest.
Knowing the symptoms of cardiac arrest and what to do is more important than ever as health experts continue gathering more information on Damar Hamlin's condition. Earlier today, I spoke with a health expert over at Arnett Health who described specific conditions that can lead athletes into sudden cardiac arrest, one of them being what happened to Hamlin.
Most of them kind of center around structural or genetic abnormalities that individuals do not know that they have. The other one is a condition we call commotio cordis, and that is where you get a direct, blunt force directly to a certain part of the heart or on the chest wall that causes the heart to go into ventricular fibrillation, which is a kind of quivering of the heart rather than an adequate normal heartbeat.
Recognizing cardiac arrest is not easy. Dr. Jeremy Lux adds that having the knowledge cardiac arrest can occur during a sports game is important.
The reason why that first 24 to 48 hours is kind of critical to know is after somebody suffers a cardiac arrest, the brain is not getting adequate oxygen or blood flow. So the sooner you can get that reestablishment of blood flow, you can temporize it with CPR and then getting that shock in order to get the heartbeat going again, the sooner the better.
After recovery, there is typically no long-term damage to the heart.
It's all brain. And it's a matter of waiting for things to kind of come back online, for the brain to recover from the insult, and seeing how much damage occurred.
For cardiac arrest patients, noticeable recovery takes about 24 to 48 hours. Jacob Matthews, 18 News.